Obviously, lots of concerns for people who have been asked now to go back to work. They've obviously probably been talking to their employers. The employers wondering how they're going to keep their employees safe, and also lots of parents and teachers worried about children going back to school. We know that Sir Patrick Vallance and Professor Chris Whitty, the Chief Science and Medical Advisors to government, so they've been involved in all key aspects of the plan. Can you help reassure people listening right now that leaving lockdown, if people have been completely locked away for the last 50 days, is going to be safe to do as long as people follow these precautions?
I'd like to be completely reassuring. However, I don't think I can be, because we just don't know precisely where the cases are and where hotspots are. We know, that some people have had the infection, but we haven't done enough testing to be able to say exactly how many people have had the infection in a big city or in a rural area. We have some estimates. The central estimates say 136,000 people currently have the infection, and 4% of the population outside of London have had the virus, but they're estimates. So I don't think I can be completely reassuring.
Because we don't have that. Well, we're going to be talking...
work.
Yeah, we're going to be talking to the Health Secretary, Matt Hancock, in just a few moments. And this is one of the big issues in terms of, testing and tracking and tracing. Are you saying that, look, for a lot of people going back, we simply don't know where and when it's safe because we don't know if people have got it in the community right now?
I think that you summed it up very well. We really need to have far, far, far more testing and tracking and tracing to be confident.
But the Office for National Statistics, their new data suggests after they basically did a test across the country of people, and they discovered that 0.24% of adults, some 136,000 people, have the virus. Now, there's a big margin of error in either direction, so it could be far, far fewer than 100,000. It could be 250,000. But either way, we are looking at a tiny, tiny proportion of the country who've actually got this virus at this time. Currently, we are not in an epidemic on the technicality.
Well, the ONS, the Office of National Statistics itself, points out the limitations in the data. You've pointed out some of the limitations. I mean, if we compare ourselves to South Korea, I don't think the starting point today is great, with nearly 4,000 new cases a day. Compare that to other nations. This is not the low level which you would ordinarily expect to be easing lockdown. And the infrastructure, I don't think, is there. I mean, you know what public transport is like in our big cities. We can't suddenly create cycle lanes, and there are many people who won't be able to walk or cycle to work and may not have access to a car. Where I live, 20 to 25% of the population do not have access to a car, but many of them equally would not be able to safely cycle or be able to walk to work. And that puts some groups particularly at risk of getting to work.
And this is it. There will be a lot of issues for a lot of people. There's also concern that actually it's the front page of The Guardian today, that it's working class men in frontline jobs who are far more likely to be the ones who die. But I mean, again, that we would expect that to be the case. We know that people who are able to sequester themselves behind closed doors are less likely to come in contact with the virus. But we have thought that women working as carers are twice as likely to die as those in, say, professional roles, because obviously not actually out and about. But men in low-skilled jobs 4 times more likely to die. So there has been some talk that this is a lockdown release which affects different people in different jobs and on different incomes very differently.
You are correct. Just because we expect something does not make it correct. We haven't had an equality impact assessment on this. Yes, men working in the low-skilled occupations have the highest rate of death, and the healthcare workers, who are mainly women, have an abysmal rate of death. And what does that say about us as a society and how we have valued these skills and these jobs? I hope. Well,
but does it? I get a bit fed up of hearing this. Again, you can value somebody, but they don't necessarily need to be on high pay. We know why some people are paid less than other people. It's because in the marketplace, they have someone can still do a job that is highly valued, but isn't necessarily something you need a lot of qualifications or specific skills to do, and therefore anyone can do it. And that's why those jobs then can have a lot of competition and therefore don't command a higher wage. It doesn't mean you don't value those people.
Julie, I work as a GP in the daytime. I have care workers come into me who, if they don't get their pay on the day, they have no protection. So they go out to work ill, or their children go hungry. I live in the town where the food banks were set up. We have an increased use of food banks by people in work, many of them working 2 jobs. Tell me about value.
I don't think those I don't think those are the same things at all.
Well, who would you value to look after you when you are really sick? You would think that was a highly skilled person.
No, I wouldn't. No. I have an elderly aunt in a care home right now, and the people who work there are absolutely wonderful and lovely, and we're very grateful to them and treat them with absolute the respect and admiration that we have. But it doesn't mean necessarily they're worth being paid £100,000 a year, because it is not. I'm afraid, although it's very valuable work, it's not very highly skilled work in the same way that someone who empties the bins and someone who does the ironing, it's very valuable work, and everybody. Hey, look, I've been a cleaner, I've stuffed envelopes for a living, I've been a waitress, I've done the bar work. Those jobs are all perfectly valuable, and people should be treated with respect for doing them, but that doesn't mean they should be highly paid as a way of showing that we value them. That's just not the real world.
So many of those care workers will work the whole year to get what some of our top earners get in the first 3 days of January work.
What's that got to do with anything? Well, hold on a minute. If everybody can run a multi-million-pound business, and if everybody can be a GP, then if everyone could be the chief officer at the British Medical Association, then they'd do it, wouldn't they? But the point is, we can't all do that. We're not all skilled in the same way, and that's why people are paid different rates of work.
You are incorrect about the level of skill. At the moment, the reason we see people in care homes dying is they have inadequate PPE, but also you have to be very skilled to put your PPE on correctly and to take your PPE off.
You don't have to be very skilled to do that. You need to be told how to do it correctly. But the idea that that's a skill that, for instance, involves 7 years of education in a medical school is, with all due respect, this is, I think, one of the issues a lot of people have with this at the moment. This pandemic and this scare we're all going through is being used for some sort of class warfare, some idea that our society is terribly, deeply, fundamentally unfair, as opposed to it's a free market economy. And funnily enough, if you ain't got any GCSEs, and if you haven't got loads of great qualifications, you don't have unique skill which can command a higher income, you're not going to be highly paid. And it doesn't mean that people can look down at you or think your work doesn't matter. I'm as grateful to the person delivering my post and people cleaning my street, as I am to my doctor. But it doesn't mean they should be paid the same.
It takes a lot of skill to look after a dying person when that dying person has no access to their relatives. An immense amount of skill to do that with love and with care.
Didn't say it didn't. Just finally, do you have a cleaner by any chance at home?
No.
You don't? Have you ever had a nanny or anyone looking after your kids, care for your kids?
Yes.
Yeah, and what do you pay them?
They have living wage, plus they have terms and conditions of service with paid sick
Yeah, but you don't pay them the same as they pay yourself, do you? Funny that. Did you see my point?
I wouldn't compare what a cleaning agency does with what care workers are doing with dying people who have no access to their relatives at the moment.
But again, being a loving, caring, kind person who's a wonderful carer to a relative is still not the same as being a highly skilled person who can then command higher wages. Anyway, I think we're going round in circles. Well, look, we'll have to agree to disagree on this one.